The Australian government wants to deport a 6-year-old child of immigrant parents because he was born with a disability. Kayan's parents were on track to receive permanent residency, having paid their taxes, passed criminal checks and complied with everything required by the Department of Home Affairs, until Kayan was born prematurely at 32 weeks with cerebral palsy. This can be an automatic fail because under Australian law, the Migration Act is exempt from the Disability Discrimination Act. The Commonwealth shall have no right to withdraw, qualify or restrict those rights of citizenship, except with regard to one particular set of people who are subject to disabilities as aliens and so on. Subject to that limitation, we ought not, under this Constitution, to hand over our birthright as citizens to anybody, Federal Parliament or anyone else. The health screenings required under the immigration laws are just to ensure that applicants will not be a burden on the community, especially its health services. Children like Kayan have been most affected by this policy, as costs are calculated over a lifetime. Australia has been deporting families with their disabled members for decades, considering them burdensome and undesirable as immigrants. In 2001, Sharaz Kian, a Pakistani refugee, set himself on fire outside Parliament House in Canberra over fears of visa rejection for the third time. The visa applications for his family were rejected because the healthcare for Kian's disabled daughter would be more than $300,000. He died from his burns several weeks later. In 2013, an autistic Bangladeshi teenager's deportation made headlines, but she was then granted permanent residency after the Assistant Immigration Minister intervened, considering the contribution of the family to society. In 2015, the Immigration Minister had to intervene to prevent deportation of another Bangladeshi couple, both doctors, because their son had mild autism. Despite rising resentment over the treatment of disabled immigrant children, Australia has done little to ease restrictions on disability in immigration policy. Although the Migration Act was amended in 1958 to remove restrictions based on race, the health clause remains to exclude people with disabilities. The government ensured the Migration Act remained exempt from its own 1992 Disability Discrimination Act, despite openly ratifying the UN Convention on the Rights of Persons with Disabilities. In Kayan's case, the Department of Home Affairs made it clear that his disability is the only reason the family cannot stay. In a rejection letter sent last month, it said it estimated Kayan would cost taxpayers $1.23 million over 10 years, which would be likely to result in a significant undue cost to the Australian community in the areas of healthcare and/or community services. Kayan is attending a specialist school and making progress with his speech and mobility. His deportation to India terrifies the family, as leaving Australia is a death sentence for some children. In Western Australia, another immigrant family from the Maldives has been fighting to stay in Australia after their son acquired a brain injury during birth. Their request for permanent residency was also rejected because of their son's condition, which requires complex care. The number of deportations under the notorious Section 501 of Australia's Migration Act has increased nearly tenfold in under a decade. Last year, some 1,029 people were forcibly removed from Australia, the second highest number on record. Exact data on the number of disabled children ordered to leave Australia is not available, but advocacy groups say they come across about a dozen cases each year. This month, Australia secretly deported a minor to New Zealand, and Home Affairs Minister Peter Dutton described the deportation flights as taking the trash out. Is it time for Australia to change this evidently discriminatory practice?